Health Sector Union Hospersa is not impressed with the turnaround of the Northwest Health Department. It's accusing the department of dragging its feet following yet another fire that destroyed a public health facility. It says the department hasn't moved since the Christiana clinic burnt down this week. The area is still reeling from a fire last year that destroyed Christiana Hospital, which remains closed. Well, let's discuss this further then. I'm joined by Kevin Halama, who speaks on behalf of Hospersa. Good afternoon, and thank you for joining me, Mr. Halama. So, this was the second fire, by the way, in Christiana affecting a health institution in that area. You are training your sights on the Department of Health in the province. Why is that?
Good afternoon, Thulasizwe and the viewers. This is definitely the second fire. Last year in September, the Christiana District Hospital burned down. And then in December, the Northwest Department of Health made an announcement that the hospital will be reopened. This hasn't taken place. And now the Christiana Clinic has now burned down as well, which now basically means that community members in the area are going to be facing quite a difficult task accessing public health services, whereby they are now being referred to hospitals that are around 100 kilometers away, because now that the clinic that was filling that small gap that the initial hospital was filling, that clinic has also now burned down. So we are saying that it's unacceptable that since December up until now, the department has not made any permanent measure to ensure that communities within Christiana, they access public health. And as for our members, because our members have now been deployed in faraway areas, and some of them are working in makeshift places whereby they're working under PVC tents in this cold weather, Thulasizwe. So we can't take it anymore, and we're definitely going to escalate this matter so that we can find a permanent solution.
Is this to suggest that the department is not doing anything at all towards restoring normalcy to that situation? For instance, around the Christiana Hospital, which burnt down around September last year, the promise is now that the work is ongoing. And it will be restored because the building itself, in terms of the walls, was said to be something that can be redeemed and continue to be used. It hadn't burnt down to the point that it couldn't be used anymore. So are you saying that there's no work being done to restore that Christiana Hospital? Because I imagine that you would understand that for as long as it's a process to get it back to full functionality, there needs to be some interim measures which will include prefabricated structures, people being deployed to clinics and other areas.
I think at the heart of our complaint, Thulasizwe, is that in December, the health MEC in the Northwest is quoted on record saying that the hospital is going to reopen in December, about the 20th of, I think it was 20th of December. And he went back on this promise and put a date for April. And now in April, we still do not have any temporary structures within the hospital that are servicing community members. And now that this clinic has burned, we've received a new date, which is now November, for when these temporary structures are going to be set up. From our understanding, what the department is saying is that it's a procurement issue, whereby they are still finalizing their procurement processes for the temporary structures. We are saying this is totally unacceptable to Thulasizwe. We do understand that there are processes to ensure that the permanent refabrication of the hospital have to take place. But in the meantime, nothing is actually being done to ensure that community members are accessing quality primary healthcare services in the area in the form of having those temporary structures built, because they are calling it's a procurement process. But how can a procurement process be dragging from December up until now? We are almost a year into the time when the hospital burnt in the first instance. So we are saying this is totally unacceptable.
Hang on, Mr. Halama, are you saying to me that there are no temporary structures put in place because everything is stuck at procurement?
Yes, that's the communication that we have received from the department, that they have not put up any temporary structures, and our members, the ones that were stationed at Christiana Hospital, they have been deployed to PVC tents, whereby it's not an adequate structure where they can be performing primary healthcare services to the community. Hence, we are saying that we find this totally unacceptable to Thulasizwe. We demand answers, and as next week, we are going to be meeting with the administrator in the Northwest Department of Health to ensure that the department is taken to task in dragging its feet in ensuring that temporary structures are put up there at Christiana Hospital, even while the refabrication in the hospital are taking place.
So I imagine then that you are concerned that the plight of your members, but also patients as well, will likely get worse now, because my understanding is that that Christiana clinic that is now burnt down was carrying some of the load from the Christiana Hospital, which burnt down last year in September.
Yes, our members were deployed to Christiana Clinic, and they also deployed to other facilities around the area. I think there's two other clinics that are around the area. But for really serious medical issues which demand a hospital, patients are being referred to Schweizer Reinecke, which is around 100 kilometers. Others are being referred to Taung Hospital, which is also close to 100 kilometers. And our members, the ones that have been deployed, I mean, you can understand, Thulasizwe, no increment has been received by public servants. So it's a further burden on them to be using additional transportation to be getting to those facilities. Even when they get to those facilities, there isn't enough space for them to be working there, because there's already staff members that are working there. So, and it's quite a frustration on their part in that no one is talking to them about the reopening of their initial hospital. And it's also causing a huge economical or financial burden on them to be traveling to far away areas which they were not working in the first place.
All right. Kevin Halama, thank you for sharing those insights with us here on eNCA. He speaks on behalf of Hospersa, who are concerned about the situation in the Northwest, particularly around the area of Christiana, where a hospital burnt down last year, and then just a few days ago, a clinic which was carrying some of the load of patients has also burnt down now, and that is impacting on delivery of services.